Why does your back hurt? It's a common question people ask all the time. Why does my back hurt? My back's been bothering me more. I got up and I'm stiff. Sometimes I feel like I just have too much pain in my back. I can't walk as far as I wanted to. It's hard to get out of a chair. My back hurts. There's so many different reasons why our back hurts. Our spine takes on a tremendous amount of force and pressure throughout our lifetimes. And what I'm understanding as I'm aging myself is that, we have a spine that's intended to help support us throughout our lifetime. But the wear and tear that our body takes throughout each year, each decade, it just adds and piles onto the stress and strain on that spinal structure. So our spine's main job is to hold our body upright and to attach all of our limbs to it and to have a connection where we can have everything working together. The problem with a lot of back pain and back issues is mostly, in my opinion, after practicing for as long as I have, is posture. Posture is the biggest thing that really plays into most spinal issues. Now, does that mean we have bad back because we had posture problems our entire life? Can I not have a herniated disc from a car accident or from a fall or some other injury? No, that's not the case at all. But what happens is as our spine doesn't get treated the way it should from the time we're younger, it starts to take on a lot of different wear and tear and different alignment issues that occur as we age. So when you have a fall that occurs or a car accident or something else that's more of a trauma to the body, that just makes things worse at that time. But if your posture was bad prior or leading up to that, that had an impact on what was happening as well. Now the car accident or the fall is just what made that come to light now and created more of an issue. So when it comes to our spine, what's really happening in our spine? Well, just to give a quick anatomy lesson here, we have 7 cervical vertebrae in our neck area here. We have 12 thoracic that go down our mid-back, and then we have 5 in our lumbar region. And at the bottom of the lumbar region, which is where a lot of people kind of get confused on what's happening here, we have our sacrum, which comes down here into our tailbone, and then our pelvis is surrounding that and connecting to that region. So a lot of people will have pain in their lumbar region down here in like L5, S1. S1 is where your sacrum starts, and you have nerves that are coming off each spot all the way up and down your spine from your cervical region all the way down. Now, what happens with our posturing is our body should be in somewhat of a normal alignment, kind of more like this. As we go through life and we don't pay attention to our posture starts to fade like this, and sometimes in extreme cases out here. Now, there's any variation of the spine that can occur, but from us going from here, which is a natural position to put everything in alignment, to even just this little bit here, changes things drastically. And as you can see, as soon as I do that with my lower back, the pelvis changes as well. So if I just sit and I don't have support where I should be here, and we do this all day long at our computers and everywhere else we sit, we go like this right away. So think about hours and hours and hours of sitting like that on a normal day, and now changing what's happening at the head and neck as well. So now this head is going forward. Instead of being in alignment where it's supposed to be over top of our body, it's now leaning forward. So all of that pressure, all of that stress creates problems in our discs. The discs can herniate backwards, and then they put pressure on these nerves that travel down into our legs. So we have a lot of issues that can cause the pain in our back. For some people, it's literally just tightness in their back because they have bad posture. They were it this way at some point, and now they start to flatten out, and all these muscles down here just get tight and tense, and that can be most of their back problem. That can lead to some of the stiffness that you have as you're getting out of your bed, stiffness in the morning, stiffness as you're getting out of a chair. Can really be just muscular. The same occurs in the neck. In the neck, we have a lot of different musculature that's going on up there that surrounds into your scapula and your shoulder blade area, into your shoulders themselves. And a lot of stress and tension settles in here in the back of the neck and all these little muscles that go in the back of the skull here. And that creates a lot of neck problems there as well. So a lot of problems in our spine is truly just muscular. But then other problems that occur can be the common disc issue, a herniation. So just by example on this skeleton here, this is a herniation that's showing protruding out here. So as that herniation protrudes out, it's going to hit these nerves potentially, causing you pain either directly in that area or also potentially causing pain down the leg where that nerve goes. So when we have any kind of herniation, we have potential again to have pain directly at that spot, or anything that can travel down from there, because that's where the nerves are going. Now, in a case where there is an alignment issue, a lot of cases what happens is you have the vertebrae that are going to shift forward or back, creating again another compression area, where if the spine and the vertebrae are not aligned properly and they're out of alignment going forward or back, they're going to compress on each other when you bend forward or when you bend backwards. And so these joints here can't align properly as well, and therefore you're getting more compression there, more pain, more potential for irritation and inflammation. And most people that have back pain is really just truly inflammation in different areas for different reasons. So when it comes to back pain, most of the issues that are going to happen are come from muscular tightness. They're going to come from disc issues that can compress a nerve or possibly not put that much pressure on a nerve. They're going to come from degeneration, which is just generally, layman's term would be arthritis of your spine. And arthritis of your spine is occurring when there's degenerative changes on the joints between the spinal levels and each vertebrae themselves, or also degenerative changes that occur in the disc quality. So as we age, that disc quality gets compressed more and more because of gravity and because of our life and because of all the pressure of living all these decades that we have on this earth. And as that disc quality compresses, you have less shock absorption, which creates more pressure on the joints themselves, and therefore can also lead to pain. So a lot of people deal with just degenerative joint disease, which again is technically arthritis of the spinal joints, or degenerative disc disease, which is degeneration of the discs of your spine, causing less shock absorption in there. And then the other conditions would involve disc herniations and any kind of nerve compression or impingement that occurs because of these different conditions. And muscular tension can also create enough pressure on a nerve at times to give you the pain that you're feeling or experiencing either in the back or traveling down to the legs. So there's a lot of people that have pain just in their legs, and they get so confused. They're saying, I don't have any back pain. The reason that's occurring is because of these nerves that are traveling down into your legs. So just because it's occurring here doesn't mean that you're actually having pain here all the time. It can just be the compression on that nerve gives you the symptoms that you're having down the legs. And whenever there comes to a nerve symptom, it could just be a pain that you're having. It can also be a sensory issue that you're having. And that can lead to anything from hot and cold sensation. I've had patients complain about feeling fatigue in their legs. So if you're having back issues, one of the main things I would recommend is obviously see a physical therapist, see your doctor, ask for a prescription or a referral to physical therapy, or just call our office directly and you can come in. We'll evaluate what's going on with your spine, come up with a plan, explain to you what we're finding. Sometimes it includes needing more imaging, x-rays, MRIs. Sometimes it's not as simple as what I just explained either. There's different complicated issues that can occur that can cause back pain. But these are the general back pain issues that are going on. And again, if we correct our posturing, which is a lot of what I personally work on and most PTs would work on, because we can't really adjust or fix anything going on with your spine, whether it's cervical or lumbar region, if we don't address the posture issue. So it's kind of getting back to the root cause of what's causing the problem. And a lot of times we're very successful with what's going on. Other times it gets a little bit more complicated. But just know that there is some treatment options out there. It always takes work. It always takes getting into the situation and figuring out what's happening in order to figure out what the outcomes are going to be and what we can possibly help you out with. So give us a call and let us help you back.